Believe it or not, only been a little over 100 years since doctors gave people milk transfusions. People discovered blood types in 1901. Giving blood transfusion was a very dangerous procedure. To solve that problem, some doctors turned to blood substitutes. Milk was one, for example. And no, I am not kidding. But yes, it went exactly as you might think how it went. When folklore is strange, but reality is stranger, you open creeps curiosities, because some stories are too weird for the textbooks. For most of human history, medicine has been a very interesting and dark subject. Thanks to modern innovations, the scientific process and medical techniques are advanced enough that we can predict with almost 100% accuracy what's going on inside and what will and won't work. And we can test these theories in a way that is largely safe and scientifically accepted. But in the past, that wasn't quite the case. Take our topic for today, blood transfusions. Before the discovery of blood types, which was discovered by Karl Landsteiner in 1901, people who lost significant amount of blood were in a loads of troubles, needless to say, not because of the blood loss itself, but also because of what was used to replace such precious liquid. For a brief, bizarre time in the 19th century, scientists were convinced that milk was the perfect substitute for lost blood. However, the first successful blood transfusion was performed in the 17th century by a physician named Richard Lower. Lower successfully developed a technique for blood transfusion that prevented extra clotting, which he demonstrated by injuring a small dog and replacing its lost blood with the blood of a large mastiff, which unfortunately died in the process. The other dog, however, survived the demonstration, apparently without illness or side effects. Lower later performed a blood transfusion on a mentally ill man using lamb blood, hoping that the lamb's gentle nature would have a beneficial effect on the man. The patient survived, but his mental illness remained. In 1667, Jean-Baptiste Denis replaced human blood with lamb's blood, which was given to a 15-year-old boy and a worker man. Both survived the procedure. Denis and his assistant did not perform blood transfusion with human blood, as the process often killed the donor, so they did not attempt it with human donors. Despite the success of the first experiment, which was probably due to the small amount of blood transfused, other transfusions were unsuccessful. Denis was responsible for the deaths of a Swedish baron, Gustav Bond, and a mentally ill man, Antoine Moroy. These deaths led to the Vatican, the French government, and the Royal Society banning these experiments in 1670. Research into blood transfusions were ceased and banned for 150 years. In the early 19th century, research resumed for a short time, but nothing was developed, as there was still the problem of preventing blood clotting and the possibility of death for donors as well as patients. This raised the question of how this problem could be or should be solved. By the middle of the 19th century, doctors believed they had found the answers to this question. They didn't even need to use blood. Perhaps the problem could be solved with a blood substitute, and here they thought of none other than milk as the perfect solution. The first human milk injection was performed in Toronto in 1854 by Dr. James Bowell and Edwin Hodder. They believed that the oily and fatty particles in the milk would eventually convert into white blood cells. Their first patient was a 40-year-old man who was injected with about 340 milliliter or about 1.5 cup of cow's milk. Incredibly, the men survived and tolerated the treatment quite well. Encouraged by this success, they repeated the procedure. They tried it 5 more times, but their patients unfortunately passed away. Despite their failed attempts, milk transfusions became a common treatment in North America. Most of the patients were people suffering from tuberculosis who complained of chest pain, headaches, and eye twitching after their treatment with milk. Only a few survived these procedures, and according to the doctors who performed these treatments, the patients got better after the transfusion, even if the patients did not agree with their statement. But despite this enthusiasm on the doctor's part, most of their patients still fell into comas and later sadly died. Nowadays, most medical treatments are tested on animals and then later on humans, but with the injection of milk, it was the other way around. A doctor named Dr. Joseph Ho decided to make an experiment to see if milk was the cause of the death of these patients. The man injured dogs, then waited until the unfortunate animals lost consciousness from blood loss, then injected milk into the bodies to see if they woke up or not. All of the dogs died in these cruel experiments. But Ho didn't stop there, as he believed that it wasn't the milk itself that was responsible for the deaths of the dogs, but the amount he used. And in an epiphany, he even thought that animal milk was to blame for the failure of these treatments in humans. So in 1880, Ho collected milk from women with the aim of finding out if animal milk was to blame, or he can use breast milk, as maybe the animal blood was incompatible with human blood, and replacing it with breast milk would work better. So he injected the breast milk into a woman who had a lung condition and whose heart stopped shortly after, needless to say. Ho was able to revive the unfortunate woman with artificial respiration and an injection of a mixture of morphine and whiskey, if everything else wasn't bad enough. But this time around 1884, the promise of milk as a perfect blood substitute had been completely disproved. By the turn of the century, we had discovered blood types, and a safe and effective method of blood transfusion was established. In 1901, Australian physician Carl Landsteiner discovered the first 3 human blood groups. He named the blood types A, B, and C, and type C was later changed to type O. Landsteiner's colleagues Alfred de Castello and Adriano Sterli added the 4th type AB after 2 years of study. His discovery won him the Nobel Prize for Medicine in 1930. However, everything that we just listened to begs the question, would these discoveries have occurred without the dodgy and weird practice of injecting milk into the bloodstream? Would we still have the medical advantage we have right now, or would we still be finding white spots in the dark? The only answer we have right now is that thankfully these practices died out, and we can now confidently know that when we go to the doctor, we will not be subjected to any of these weird experiments and ideas. Truth, folklore, or something in between. Some stories just don't belong in textbooks, but they find a home here, with me. My name is Creeps. Thank you for listening.